Hello, I'm Dr. Beckham from All Seasons Full Body Chiropractic Center, and I have Dr. Jager with me here today.
Oh,
And what we want to talk about just this week here is I thought we'd start with some topics of just the types of conditions that happen to be, rolling into the office here. I'm talking with Dr. Jager. Uh, Basically, both of us have been seeing new patients that have had, more lower back pain just this week here. So what that correlates to, probably just people doing more work at home, although they've probably gotten to the end of their list of tasks that they need to do at home with the COVID here right now. But what have you been seeing, Dr. Jager?
uh, quite a few things that I've been seeing too are disc herniations, actually, or herniations, sorry, bulges. Seeing a lot of that. A lot of people who are having to sit now as opposed to standing or moving quite a bit for work. They're starting to get a lot of hip flexor issues that are relating to their low back pain, starting to cause hip pain as well too. So, kind of a combination of those three things that I have been seeing quite frequently over the past few weeks.
Yeah, I mean, I guess that's kind of the typical thing that I'll see here too. Is a lot of patients will come in. They could have disc bulges, they could have degenerative discs going on, um, some with some sciatica going on. So there is that possibility of having a disc or a degenerative uh, joint, whether that be the bony part or the disc itself, irritating the nerve roots. I've seen a few of those. Um, Definitely the hip flexors. That's almost what kind of gets kicked in on darn near everybody that has a disc type problem because it's one of the muscles that will just get shortened. Plus, yes, with people sitting down a lot here, uh, your hip flexors, when you sit for a prolonged period of time, they're basically going to be in a shortened state. So when you go to stand up, and like maybe now because people are a little bit more active, they're at home, they're up and down, moving around. They probably are sitting down for periods of time during the day, working on their computers or doing things that they're just not used to doing and stressing their bodies in ways that, if they were sitting at work, they probably wouldn't notice it as much. But um, yeah, it ends up causing then problems down into the hips and legs. I know with some of the testing that we do in the office here with our Kinetisense, um, it says balance on the report there, but it's really testing proprioception. So it's looking at how well the person's brain and body are connected together, and almost everybody kind of fails that test to some extent. Some do better than others, but if they have a disc type problem going on, or they just don't have really good control over their hips and pelvis, they're not going to be able to maintain that. So
Right. Yeah. It's with the stuff that we use kind of on our initial exam and re-exams, we do get to see a lot of those variances of people who again, they feel like they're doing real well because they don't have pain, but you start putting those just simple tests of functional movements, and they have a lot of discrepancy in their ability to do those movements or efficiently, actually. So
mhm.
we do see that quite a bit as far as some of the other tests too, just assessing how the muscle tone is or the hypertonicity from the right to left. We do have some stuff that allows us to see exactly where people are having those issues that are and can be related to some of the problem areas.
So yeah, I mean that would be like our surface EMG test. So with our functional tests, everybody gets a report to see exactly where they're at. We explain that to them. The surface EMG test is looking at just how stressed the nerves and muscles are along their spine, and again, we usually go over that with people as well. But a lot of these people, they're kind of almost stuck between a rock and a hard place. They've already tried their non-steroidal anti-inflammatories. They've tried heat. They've tried somebody massaging it at home or something like that. They maybe went into the medical clinic and probably gotten some muscle relaxers or some other kind of pain medications. But those are all kind of symptomatic. They're just covering
Right.
up some of the symptoms here. So
Right.
once they get in the office here, we have a high percentage. I would say in the high 90% where people are getting better. Most people will get resolved in a period of time. We'll sit down and even go over once we do that initial assessment, what does show up with those tests there, and kind of outline a path for them as far as how long it's going to take, how many visits it's going to take,
Right.
even how much it's going to cost for them there, so that they know ahead of time here if they want to go forward with the treatment. And then we get into the treatment aspects there too. So
I think as we go through it too, we're addressing the main issue that they're having, And I think as we start addressing that and they start one feeling better in that area, they start to realize that there are other areas that we're finding too that are like um, underlying issues that they didn't realize they had. One might be like a piriformis issue, or realizing that they also have some other knee issues or lower back issues as a result of it too. Kind of moving upstream towards the mid back or towards the neck as well too. So, I think that people are seeing the benefit of one addressing the symptom part, but going beyond that. And then, they're also finding it too that once they get past the pain, that they want to get better, they want to stay better, they want to feel better, but that they're realizing it takes time and persistence to get to that point as well.
Yeah, I mean, and most people, come into our office just like they come into, most chiropractic offices. I mean, they think that, hey, we're going to help deal with whatever they have kind of going on with their spine. I mean, and that's really kind of where we start, just like every other office does. We're going to try and make sure that we're clearing up whatever is going on with the spine and neurologically there as well. But like I say, just with some of that testing that we do, we're also looking at what's called your kinetic chain. So looking at, do you have some problems down with your feet or your knees or your hips? And if those are going on, we want to get those cleared up. Otherwise, hey, you're just going to end up coming back and never really getting your problem resolved here. And that's some of the frustrations that a lot of people have is that, hey, once I keep going to a chiropractor, I have to keep going to a chiropractor because that's the only way I'm going to feel better. Well, we try and get down to the root cause of your problem here and deal with all of the biomechanical issues here so that, it's not that you have to come back, it's because you want to come back because you know that you're going to maintain what you've already gained from the treatment here. You're going to finally feel good and you're going to be able to do the things that you love to do without having that pain or restriction. So,
Right. Yeah. And a lot of people are, again, they're making that connection.
yeah.
No pun intended, because they're getting that connection with the nervous system. But yes, they are making that connection of seeing um, the long-term result as well too. But again, everybody starts somewhere. What we're seeing right now, I'm seeing a lot of people with low back issues, and it is coming from either a disc bulge, a sciatic issue. They're having piriformis issues, which is
Mhm.
right underneath the glute where that muscle tightens up with the sciatic nerve, and then hip flexor issues as well too. So there's a whole cascade of stuff going on. They just don't know where to start. And so if you're looking for that place to start, this is again we're two docs who are looking to help you um, get that off on the right foot, so that we can help you again get back to enjoying the things that you want to do.
Yeah. I mean, and with those initial tests, there's other tests that we do as well. The other big thing is that we are retesting people with those same tests again, so that you can even see for yourself that you're getting better or you're not getting better. And then, we use those to even adjust our treatments here to make sure that you are getting the best treatment you possibly can get, and we're getting you back, on the road to finally feeling good. So, I guess any further questions or anything like that, feel free to contact us here. If you want to schedule an appointment, go ahead and do that as well, because you can sit down with us and we can let you know what's going on and how we can help you. Thank you.